Hello, everybody. So today I have Grant Zarzour, founder and CEO of Sperity Health, on to talk about the opportunity in longevity for employers. So before we get started, we'd love to give you guys just a little bit of background about Grant. Grant, like I said, is the founder and CEO of Sperity Health. He had a private practice as an orthopedist that grew into about $35 million and became the largest orthopedic practice in the state of Alabama. He is also on the board for Lantern, one of the leaders for Young Presidents Organization in South Alabama, and also has a foundation that helps underserved children in Alabama as well called the Fuse Project. Welcome, Grant.
Well, thanks so much for having me, Lindsay. Pleasure.
Wonderful. Well, so maybe to set the stage, it's kind of an interesting transition to go from, an orthopedic surgeon to, it's founding a longevity company. Would love to kind of hear your thoughts on, what the opportunity is, why you decided to found a company in the longevity space.
Yeah, thanks. I do hip and knee replacement all day and still practice orthopedics, and I practice reactive medicine all day. People come in with a problem that's been brewing for a while, and they've kind of maybe neglected their physical activity, maybe their muscles a little bit, and so the bones deteriorate. So I think so many worn out hips and knees that I thought, is there a preventative thing that I could be doing to help patients to prevent them from getting down this path? And then I had a couple family inputs. I'm blessed to have a beautiful wife and four children. And my oldest child, Wyatt, when he was born, our first child, and he went to school for a few weeks. And then the school called and said, something's not quite right with Wyatt. He's our first child, first time parents. He's 2 years old. My first reaction was, what's wrong with my boy? And they said, you got to go get him checked out. And so we went to a neurologist, and within 15 seconds of being in the room, the neurologist said, this boy needs to be on an antipsychotic medication at 2 years old. He's never going to make it at regular school. And mom, dad, buckle up. It's going to be a long, hard ride.
That's scary.
And Bree and I kind of looked at each other and go, we don't accept that. We're going to solve whatever this problem is. And so he got diagnosed. He's on the autism spectrum, and we got all sorts of great speech therapy and occupational therapy. We found a great functional medicine doctor who believes in supplements and all sorts of great solutions. We've done neurostimulation, which is a really cool technique for helping the brain. Long story short, he's 9 years old. He's in regular school. He's flourishing. He's the top kid in the class. And he takes the autism, you're supposed to take the autism test every few years. I don't think he's going to qualify anymore when he takes it next month.
That's awesome.
And so I've had some neat achievements in my life, notably getting my wife to marry me. But this is the biggest on getting the diagnosis off of his list. And so it's been fun. But so that really pointed me toward, wait a minute, if you get to the right doctor and you take the right steps, what could happen? And so these longevity ideas can apply to anybody, but it's become really popular now in the space on diet, exercise, and nutrition. And how can those of us who are in our 30s, 40s, 50s, 60s, 70s, if we want to tip the scales to live a longer, healthier life, can we do that? And the answer is yes, but you need a longevity quarterback. And that's why Sperity Health was started.
That's awesome. That's really exciting. And I love it when people have kind of that personal story that, really fuels the founding of the company. It makes a ton of sense. Your son's very lucky to have so many resources as well. I've heard you talk a little bit in the past about the concept of medicine 3.0. Can you share a little bit about kind of this idea and what it means for longevity and what you're doing at Sperity?
Well, I think where we're living now, and Peter Attia has made this famous, that medicine 2.0 is where we live currently. Your typical medical professional lives in a reactive world. The analogy is we're trying to get people out of the river, but 3.0 is to get them before they fall in. And there are a lot of things you can do, and it's focusing on diet, exercise, and sleep, and then the labs and imaging that you can do to supplement that. But today's health insurance doesn't value preventative medicine. It more is able to understand reactionary, respond to the stage 4 problem. Sperity Health wants to diagnose it at stage 0 or stage 1, when it's a lot easier to solve an issue or even prevent an issue from arising. Cardiovascular disease is a very common issue. And unfortunately, there are a lot of hidden symptoms that you can't tell you have cardiovascular disease until it's a very serious problem. So this 3.0 medicine technique is really resonating, I think, across the country because people are like, wait a minute, you can do things to prevent these diseases? And the answer is yes.
That makes a lot of sense. So, I mean, I think that there are a lot of kind of, buzz in the space, and there's some more consumer platforms that have been, kind of getting some brand recognition. Could you talk a little bit about how, what your solution and what you guys are doing is maybe tackling the problem differently from some of these consumer platforms?
Yeah, Sperity Health, we're really a B2B solution, and our goal is to help the executive live that longer, healthier life so they can stay a productive member of their family, of their job, of their community. And a lot of times, executives are real busy doing a whole host of things for their business, and they don't have enough time to focus on their own health. And so our goal at Sperity Health is we bring the Medicine 3.0 solutions. We have a primary care physician who's a longevity expert. We have the exercise physiologist, the nutritionist, the phlebotomist. We bring it all to them on site. And so your engagement is much higher. Engagement's certainly an issue in the B2B space. And it's because that executive says, wait, what is this on my calendar? Just cancel it. I can't go. I can't drive across town to wherever that is. And so we've realized that what if we brought it to them and had a very high quality offering, and now it becomes a much simpler, easier ask to get on that executive's calendar, and then they get to understand their health. And we say our goal is to teach, not preach. But when you show someone data, like their KPIs for their business, everybody's following how are we doing on our net revenue and our expenses, and how is my personal wealth doing with the 401k or the bank account? Well, how's your health doing? And there's usually some blank stares. And our goal through our app and technologies, we kind of communicate with you. Here's your situation. Here's how you compare. Like we look at your biological age. Your chronological age is your birthday. Your biological age is what your organs say you are. And the only number that matters is the biological age. So we monitor that and then educate you on what yours is and then steps you could take to improve that. And we found that that's a great way for kind of these solutions to resonate.
I guess that since you have founded a nonprofit to serve underprivileged children in Alabama, you probably have aspirations of maybe bringing this to other populations in addition to executives longer term too. Would love to just kind of hear your thoughts on that.
Absolutely. I mean, these solutions aren't terribly difficult, but you just need the right quarterback to help you go through the process. So people will read an article or read a story and they go, man, I'd love to do this. I just don't know how to do it. And we have got to get access to all parts of the community toward living a longer, healthier life. Noticeably, one big solution that we've got to work on, certainly in a lot of different areas, is access to healthy foods. A lot of people's main access in the inner city is the 7-Eleven for their health food. And so we need fresh fruits and vegetables, and that's a big part of being able to sleep better, perform in sports better, and your exercise. And it's all very connected. We just have to improve access. And so that's absolutely our dream, is to be able to spread this to all aspects of the community.
Yeah, no, that makes a lot of sense. I've done a lot of work in the past kind of in the food as medicine space, and I just think it's so fascinating. My mother's a registered dietitian, so I've just always been super interested in this entire space with food and nutrition and longevity. So,
food is the only way that your body communicates with your cells. I mean, so whatever you're putting in your body, and the gut to brain axis is very real. And all the different disorders and things we have, a lot of them could be helped. I'm not saying solved, but a lot could be helped if we worked on diet really fervently.
Yeah, absolutely. So I guess kind of along those lines, so this seems to be, a pretty hot topic with consumers, and just, there's again a lot of like buzz and interest in the space. What do you think is kind of fueling the demand from like the patient perspective currently into the area of longevity?
I think for forever, everybody thought, it's kind of predetermined how long I'm going to be here. We all have parents or grandparents who said, when it's my time, it's my time. And we're realizing that genetics plays a role, but if I had to put a number on it, it's 20%. I think 80% of how long you're going to live is your personal decisions and choices. And so now that we're realizing that through the data and the science that's coming out in all these great journals, is that, wait a minute, if I focus on the diet or focus on the sleep or do whatever these things we've talked about, that I could live longer and healthier, because everybody's goal is to be active and stick around as long as they can, but nobody wants to be in a state where they're not able to do as much. We want to increase that health span, and so that's what active till your mid 80s. And I'll tell you, there's no reason everybody listening to this can't be active to their mid 80s, but it just takes a coordinated effort. It's not going to be just we'll plug in here once a month or try to exercise a couple of times. That's good. That's a start, but we really need a comprehensive solution to hit that goal of staying active to your mid 80s.
I love the term health span. I just think that really like speaks volumes in terms of what you're actually trying to achieve. And I think that can maybe also help change some people's mindsets where they think, well, I don't want to be 80 and unhealthy, so, I might as well die early. And it's like not like the same choice, so anyway.
Exactly right. It's a big difference between health span and lifespan, and people are becoming more aware every day.
Yeah, absolutely. So I would guess that just kind of given your solution, you probably have some fantastic patient stories. Would love to hear one if you've got one that pops to mind.
We have several members that we've really been able to help. We recently had one member 2 weeks ago that got a calcium score, which looks at the blood vessels around your heart, and it tells you what kind of hard plaque there is or calcium buildup. And you want a low score. The lower, the better. And he got a 0. And his traditional primary care said, you're good. Come back in 10 years. You don't need to see a cardiologist. You're fine. And we told him, well, with your Sperity Health membership, it includes a CT angiogram. And he said, what's that? And we said, well, it's a little different than that calcium score. It shows the soft plaque around your vessels, which is more likely to cause a clot. It can break off and cause a stroke or a heart attack. And he goes, well, I just had the thing for the hard plaque. I said, well, you have to understand the soft plaque's a little different. You don't have to have this, but it's what you've included in what we talked about in cardiovascular disease. And he said, okay, I'll get it. 70% blockage on one of his vessels, and was evaluated for a stent the next day. These are the people who at their desk slouch over with no symptoms prior to a heart attack. And cardiovascular disease is so common. And, there's all sorts of stories. There was a football coach at Alabama that Nick Saban put through a similar process that had a huge blockage, and thanks to a CT angiogram. But insurance doesn't cover a CT angiogram unless you're having major symptoms. But the most common first symptom can be sudden death, which, obviously that's a tough one to come back from. So we have to be preventative there. And we were able to do that 2 weeks ago. And then last week, we had a really active member, runs every day, had some lab work done, had extra iron in his blood, and got diagnosed with called hemochromatosis. It means too much iron in the blood. And he said, I feel fine. I don't know what this iron will deposit in your joints and in your heart. And it can cause heart failure if you get advanced hemochromatosis. And you get real tired. You can't do very much. And this guy runs every day, very, very active. And we diagnosed hemochromatosis at stage 0. And he's now getting treatment, and he'll never have symptoms now, because a lab test that insurance and these traditional medicine 2.0 would not have ordered for him diagnosed this. And listen, it's not every single person we're diagnosing something. I want to be clear. Most people are doing well, and we encourage them and keep them on the rails going toward a great path. But, you just don't want to find out too late that, man, if I had a simple lab test just done a little while ago, my whole story is much different than suffering at a way earlier age than you need to be. So we're just real proud of that, being able to help a lot of our members. And at the very least, they're getting a whole great exercise and nutrition and sleep plan that's really helping them increase that health span.
Yeah, that's awesome. I love that you mentioned sleep too. I feel like that's oftentimes an overlooked category.
I'll tell you, I am really jamming out on some sleep right now. I was listening to a neuroscientist this morning talk about the power of sleep. And I'm being more and more convinced on reading these articles and these journals on the data that if you don't have sleep right, diet and exercise aren't going to work. It's interesting. They're talking about depression, anxiety, and all sorts of neurologic disorders that a lot of patients with these issues aren't getting great sleep. So you have to measure your sleep. We put a Whoop band on everybody to measure your heart rate variability, because we want to know how you're sleeping and the quality of your sleep. People will say, oh, I got my Apple Watch said I got my 7 hours last night. The quantity is not nearly as important as the quality. And so it's good to get 7 or 8 hours, but we need to do certain steps to make sure you're set up for success with that sleep. And we tell people that if you cannot eat after 7 o'clock, that's great to let your body not be metabolizing anything while you're trying to sleep. Don't exercise too late. Exercise is great, but let's try to finish that up an hour, hour and a half before bedtime. Dry sauna has become real popular because of the lowered risk of dementia. Some show up to a 70% reduction because of the increased blood flow in your brain that's causing your brain to maintain very high blood flow and lower the risk of dementia. But don't do that too late at night during the middle of the day, or late afternoon is great. So that you got to set the table for sleep, and it's not easy. I have a challenge every night on trying to get a great score the night before. And if you got to set the table. And nobody's perfect. Nobody's going to get it right. And listen, they'll tell you, oh, never have a drink again. Listen, you got to still live. It's all a balance. But if we can educate you now on the steps you can take, you're going to do it more often than not. And that's going to pay major dividends in the future.
Absolutely. Yeah, and I love that like these are all like actionable things that you can take that you guys can help, people identify, because there's just a lot of misinformation too. So, and I love that you called out sauna too. We have a sauna at our house and love it. So,
Oh,
yeah.
I'll tell you that dry sauna, the studies say 180 degrees, 20 minutes, 4 times a week. 180 is not cold. I mean, the last 5 to 6 minutes of that dry sauna, you're like, Lord, it has got to be 20 minutes. And the clock looks like it's barely moving. But it pays off because your body is having to increase your blood flow. And a lot of dementias are vascular dementias where your blood flow has deteriorated to the deepest parts of your brain. And the thought is the way that dry sauna reduces this risk is it keeps those blood vessels dilated. And so they get more used to expanding and they don't get stuck being small. And so the more expansion they're getting, the less likely they are to decrease that blood flow and cause that dementia and the memory loss and all those type of things. So it's really interesting data, but it makes a lot of sense physiologically.
That's fascinating. That's very cool. Well, kind of turning to the tables to kind of employers. So you mentioned executive health programs. Would love to kind of hear, from you, your thoughts on the demand that you're seeing from employers for this type of solution, and then, a little bit about how they might think about the business case or the ROI on a solution like this.
Yeah, I'll tell you, a lot of employers that we're talking to, their first response is finally, because they've been looking for something like this and haven't found a great B2B solution. And that someone that understands that, listen, the engagement is a really important piece, and the HR director wants to see as high engagement as possible. The CFO is really worried about cost and how can we blend, and you got 3 or 4 other big parties involved in these decisions. And so how can we provide a solution that makes everybody happy while taking into account ROI or VOI, the value of the interaction. And so what we found is that corporate turnover is expensive. And so this is a retention tool to be able to offer this great benefit. Now you've got more engaged employees, healthier employees who are coming to work more refreshed because they're getting their better sleep. They're finally finding a way to prioritize exercise. And now they're like, golly, this is great. I want to stay at this business where I get this benefit, where this company believes in me. And we have all different ways where the company says, we'll pay for all of it, half of it, we're payroll deduct. We have solutions. We cater it to whatever that member and that business is looking to prioritize. So it's all kind of made for the individual company. And another thing that really has stood out is that some companies have key man life insurance where, golly, we can't lose this great executive or this great member of the team, this great manager, whatever it may be. But their only way to preempt that is, well, we'll just get a life insurance policy on them. And, the payout is only if they pass away. We say Sperity Health is the payout as they live and stay longer. And, some people are worried about how do I find replacements for these workers in the future and these great, important people. And some of the future workers have different priorities, and it's harder to replace these key, important people at the company. Our goal is to keep them there longer. And so they don't think about retiring for a health-related reason.
Yeah, that makes sense. I mean, because I think that a lot of people talk about, recruitment and retention, and that's one thing when it's the full population. But when you think about the executive population, that is the population that your business is so dependent on. So offering these types of resources that can keep people not only engaged and be attractive from a benefits perspective, but also healthier and more productive in the workplace, I would think would make a big impact for a lot of these businesses.
It is, and I'll tell you, we have, every plan, like we say, we can build for the individual company, and some of these benefits they'll include the spouse, and that's really powerful. When the executive goes home and the spouse gets to be included in some of these solutions, similar to like health insurance, they include. That's really resonated because then they get to do it together, and it makes a big impact when you're getting to take these steps together, and it really reinforces it. And then, you calculate that turnover piece. Some people say 60 to 70% of a percentage of a salary is what it costs to replace them. You think about lost revenue while they're gone and and then sometimes you have to pay more to replace. So our goal is to keep the talent in that business forever.
Yeah. I mean, especially with executives, there's going to be like headhunter costs and all kinds of different recruitment costs that are probably very expensive for organizations.
It is, and it's becoming more competitive. If you're in a competitive landscape, then having a benefit like this, where usually the competitor doesn't, and you never know which benefit's going to tip the scale on them taking the job. It's not always salary. I understand money matters, but certainly that comprehensive package and compensation matters. And we think Sperity Health is a big feather in the quill on a wonderful benefits package.
Yeah, absolutely. I'm totally aligned. I mean, I'm definitely the type that is more interested in like the benefits sometimes than some of the, other perks that you might have for working for an organization. So that makes absolute sense.
And it's interesting. I'll just point out, usually when you're selling a benefit to a team, they're trying to figure out if it's a good idea. With longevity health and trying to help people live a long time, we found that like everybody in the meeting is like, yes, I want this for me. Like, how do I get this? Because who's not interested in learning the tips of the trade and the tricks of the trade on how to live longer? So that's another thing that stands out for us, is it really resonates across the board.
Yeah, absolutely. That makes perfect sense. So obviously, you're selling into the employer space. Would love to just hear, we ask everybody this, like one lesson you've learned perhaps the hard way about the employer benefits market and how it operates, or selling into this space.
The length of the sales cycle, I will tell you, that's a fun one there on just wait, 18 months is a traditional sales cycle. And so having to understand that, in my day job in surgery, I'm not the most patient because I see a problem, we fix the problem and we move on. And but understanding all the different things that have to come together, and I'm learning about those on a daily basis. But it's important to make sure everything's aligned and it's set up correctly. So I would say number one has been the sales cycle for us on learning.
That makes sense. So kind of back on the topic of longevity then. So obviously the space is evolving very quickly. What is like one bold prediction you have for the future of longevity, say for like the next 5 years?
One, I mentioned that living to 85 and being healthy is really within our grasp, and I think that will now be the goal for everyone that takes a proactive role in their health. So I'm really convinced that 85 and healthy is very possible. Number two, I think that setting up a company like Sperity Health is challenging. You have to find a number of key pieces to put together. And healthcare, as we know, is challenging. So you need to find a great doctor who can be in each of our communities to go talk to each of our team members and our clients and our executives to be able to have that one-on-one in-person. We're real big believers in in-person and on-site. There's telehealth is a good solution in some areas. When you're talking about these type of things, I think it's real important to have a face-to-face interaction. But I think that what we're going to find in the next 5 years is longevity solutions are going to become common across the board for B2B and B2C, but there's going to be a big difference in quality. And because it's so challenging to get a great organization built that can provide very high quality solutions based on data and science, I think the high quality solutions aren't going to be available in 5 years, or it's going to be harder to find them because it's just so difficult to put together a complete package. And that's the reason every single day we're working to make sure we have every single thing certainly as buttoned up as we can to provide the best experience. And we're learning, and new data is coming out. And so you have to be able to adapt and pivot and based on the new data. But I think that in 5 years, it could be challenging to find a great solution because it's hard to replicate. There are a lot of barriers to entry in this longevity space.
Yeah, I could see that. I mean, it takes a lot of expertise to pull together a solution like that. So that makes perfect sense. So then, maybe one fun question. So when you think about kind of like key health habits, you talked about sleep. We've talked about food and nutrition. Do you have any like kind of key tip that you give everybody that wants to, live healthy till 85, like something basic that people could be doing?
Well, I tell you, the one we haven't mentioned yet, I would say is your VO2 max score, which is your lung health. And we put you on a treadmill. We bring the treadmill to the office and we get in conference room and you get on and it takes about 12, 15 minutes and it's intense. You start walking and you think, I'm crushing this. This is great. And then about 8 minutes, you're getting the incline and the speed. And then about 10, 11, 12 minutes, you're reaching for that stop button because you've maxed out on the oxygen carrying capacity of your lungs. But VO2 max is the single greatest predictor in all-cause mortality. And it's because your ability for your lungs to take in oxygen and breathe it out is how easy you're going to get over the flu or the chest cold, or be able to, you talk about wanting to be healthy when you're 85, you need to have really strong lungs to be able to glide down because it decreases with time. Everything, on your lungs is going to decrease the elasticity. But if you can start off with a nice high number, and I'll tell you, I took the test the first time a year ago. There's 6 categories. I got the very top of the very poor category.
Ooh.
It was very sobering. And I took those results and I cut them out and it's on my bathroom mirror and I see it every morning. And it motivates me to really work on, that VO2 max, which is zone 2 exercise, which is like a brisk walk. So a brisk walk, 20 minutes, 25 minutes a day, 3 or 4 times a week really can help improve your VO2 max. And you're setting yourself up, less sick days at work, feeling more stamina, more strength, and you're setting yourself up for that living to 85 and being healthy.
I love hearing that. I've been a runner forever, so that makes me.
You're in great shape then. That's good.
Yeah. Well, awesome. No, that's a great tip. Well, wonderful. Well, thanks so much, Grant, for coming on. So, just in closing, where can people find out more about you and your work and Sperity Health? And if there's anything else you'd like to share, feel free.
I'm Grant at sperityhealth.com. That's our website too. Please go on there and take a look. We're in the Southeast right now and expanding. We found that it's really resonating, and there's not a work trip I take where we don't go to a community where somebody says, well, I live in Indianapolis. How can we get this? Or I'm in Dallas. So we're really working on ways to expand in a thoughtful way to be able to bring these solutions across the country. And it's just been very rewarding because, my day job, I do about 600 hip and knee replacements a year, and I can help a lot of people, and I enjoy that. But I think we can help thousands and tens of thousands live a longer, healthier life, especially when you talk about getting it to the entire community and making this a part of a school curriculum where the cafeteria gets involved as well in healthy foods. And so there's certainly a lot of solutions in the business world, but we want to take it everywhere we can. And I think the sky's the limit because the data and the science are really proving out that if you take an active role in your healthcare, you really can tip the scales in a big way to living a longer, healthier life. And Sperity Health's thrilled to help everybody in that journey.
Awesome. Well, thank you, Grant. Appreciate you coming on today.
Thanks, Lindsey.